Hey guys, my name's Morgan. I'm a coach at the Upstate location here in Greenville, South Carolina, and today we're going to be talking all things blood pressure. So first, it might be helpful to find out what is our blood pressure. And our blood pressure is the measurement between two numbers. All right. So we have our 120/80. We have our systolic, which is our top, that 120 number we're looking at, and we have our diastolic, that bottom number, that 80. So what do these two numbers mean? Well, the systolic pressure is how much pressure our blood is exerting against our artery walls when our heart beats. So when our heart beats, it squeezes, it's pushing the blood through. That's how much pressure is being exerted on that artery wall. All right. The diastolic indicates how much pressure your blood is exerting on the artery walls when the heart is at rest. So the heart squeezes, it pumps it, and it takes that small break. Now we're looking at what the pressure is for that small break. There is still pressure on the artery walls, but it's lower now. All right. So that's what that is. So typically, when we look at which one is more important, we typically give more attention to the top number, that systolic pressure. While more attention is given to this top number, the bottom number, it's important to know the bottom number is still used in a diagnosis. All right. So the systolic pressure, that top number, is a major factor for cardiovascular disease for people over 50, and that's why it's typically paid more attention to. In most people, systolic blood pressure rises with age due to the stiffness of the large arteries and long-term buildup of plaque. So now we can look at a chart of the different blood pressure categories. Each category has the systolic measurement as well as the diastolic measurement, because remember, either of these numbers can be used to make that diagnosis. All right, so there's normal, elevated, on up into the different stages of hypertension. So as we know, when the blood starts to get thicker, the heart has to pump harder to get the same blood through there, all right? So what this means is when we eat a lot of salt or sodium and our body holds on to water, this causes our blood volume to increase, meaning our blood pressure has to increase to push that same amount of blood through the arteries. So with this chart, we also want to talk about treatment options to keep that from happening. There's medicine. Medicine can be done before or after to help try and prevent it or to decrease the effects. However, the best thing we can do are lifestyle changes. These lifestyle changes can range from reducing our sodium intake, eating a diet rich in whole grains, vegetables, and fruits. We can quit smoking, we can cut back on caffeine intake, and we can exercise regularly. All of these will help reduce that blood pressure and keep us healthy. The best advice for how to check your blood pressure is to read the directions on your individual cuff. You want to make sure that your arm is in the correct position, which is normally around the same height as your heart, not above, not below. Your palm will normally face up and can rest on a table. However, some cuffs will have you hold your palm across your chest with your elbow bent. So make sure you read the directions on your specific cuff to figure out what works best for you. Also, if you're wanting to get a resting blood pressure, try resting for 3 to 5 minutes before taking your blood pressure to get a more accurate blood pressure reading. Remember to talk with your doctor or physician about your blood pressure readings that you're getting at home. Stay safe, stay healthy, and have a great day. Bye, guys.